Hi, welcome to Professional Certifications channel. Let's break down RHIA exam, one topic a day for focused and effective learning. Today's topic is longitudinal health record in healthcare.
1. What is the longitudinal health record? Let's start with the basics. What exactly is the longitudinal health record? A longitudinal health record, LHR, is a comprehensive record that contains all of a patient's health-related information collected over the course of their lifetime. Unlike traditional medical records that focus on specific encounters or episodes of care, the LHR provides a continuous and complete picture of an individual's health history, including diagnoses, treatments, lab results, medications, and more. The longitudinal health record spans multiple healthcare settings, such as primary care, hospitals, specialists, and even home health services, and brings all of this information together in one comprehensive record. It enables healthcare providers to see the complete history of a patient's health and make more informed decisions about their care.
2. Key components of the longitudinal health record. The longitudinal health record is an accumulation of various types of health data, collected over time and across healthcare providers. Let's break down the key components of the longitudinal health record. 1. Medical history. The LHR includes a detailed account of a patient's medical history, such as past illnesses, surgeries, allergies, and chronic conditions. This information helps healthcare providers understand a patient's baseline health and make decisions about future care. 2. Clinical documentation. The LHR contains clinical notes and documentation from all encounters with healthcare providers. This includes progress notes, physical exams, diagnoses, and treatment plans. Over time, this provides a complete record of the patient's healthcare journey. 3. Medication history. A record of all medications prescribed to the patient is included in the LHR. This is important for tracking medication adherence, avoiding drug interactions, and adjusting treatments as necessary. 4. Diagnostic test results. The LHR stores all diagnostic test results, such as lab work, imaging studies, and pathology reports. These results provide insight into the patient's health over time and help inform clinical decisions. 5. Immunizations. Immunization records are also part of the LHR. Tracking vaccinations over a patient's lifetime ensures that they remain protected against preventable diseases. 6. Lifestyle and social information. The LHR may also include information about the patient's lifestyle, such as diet, exercise, smoking, alcohol use, and social determinants of health. These factors are critical in understanding a patient's overall health and managing chronic conditions. 7. Patient-generated health data. Increasingly, LHRs are incorporating patient-generated health data, such as information from wearable devices, home monitoring systems, and patient-reported outcomes. This data gives healthcare providers a fuller picture of the patient's health between clinical visits.
3. The importance of the longitudinal health record in healthcare. The longitudinal health record offers several important benefits in healthcare, both for patients and providers. Let's explore why the LHR is so valuable. 1. Improved continuity of care. The longitudinal health record provides a comprehensive view of a patient's health history, ensuring that healthcare providers have access to all relevant information, no matter where or when the patient received care. This continuity improves coordination among different providers and helps avoid gaps in care. 2. Better decision-making. With access to a complete health history, healthcare providers can make more informed decisions about diagnosis, treatment, and management. Having all the information in one place reduces the risk of errors or missed information that could affect patient outcomes. 3. Increased patient engagement. The LHR also empowers patients to take control of their own health. With access to their full medical history through patient portals or apps, patients can better understand their health conditions and actively participate in their care decisions. 4. Enhanced chronic disease management. For patients with chronic diseases, the longitudinal health record is essential for tracking disease progression and adjusting treatments over time. It allows providers to monitor how a condition evolves and how a patient responds to different treatments, enabling more personalized care. 5. Reduced duplication of services. By providing a complete record of past tests, treatments, and interventions, the LHR helps prevent unnecessary duplication of services. This not only reduces healthcare costs, but also spares patients from undergoing repeated procedures or tests. 6. Supports population health management. The LHR can also be used for population health initiatives, allowing healthcare organizations to identify trends, monitor public health concerns, and target interventions for specific groups of patients, such as those with diabetes or heart disease.
4. Challenges in implementing and maintaining the longitudinal health record. While the longitudinal health record offers many benefits, implementing and maintaining it presents some challenges. Let's look at some of the common challenges associated with the LHR. 1. Data fragmentation across systems. One of the biggest challenges in creating a true LHR is the fragmentation of data across different healthcare providers, facilities, and electronic health record (EHR) systems. Many systems are not fully interoperable, making it difficult to integrate data from multiple sources into one cohesive record. 2. Patient privacy and security. Maintaining the privacy and security of sensitive patient data is critical. Healthcare organizations must ensure that access to the LHR is restricted to authorized personnel and that proper security measures, such as encryption and audit trails, are in place to protect against breaches or unauthorized access. 3. Data quality and completeness. Ensuring that the information in the LHR is accurate, up-to-date, and complete can be a challenge, especially when data comes from multiple sources. Errors in data entry, missing information, or inconsistent documentation practices can reduce the effectiveness of the LHR. 4. Technical infrastructure. Healthcare organizations need robust technical infrastructure to store, process, and manage the large volumes of data that accumulate in a longitudinal health record. This requires investment in IT systems, data storage solutions, and the development of interoperable platforms. 5. Patient consent and data sharing. Ensuring that patients give informed consent for sharing their health data across systems is essential for the successful implementation of the LHR. Healthcare organizations must navigate complex legal and regulatory requirements related to patient consent, especially when sharing data between different organizations.
5. Best practices for implementing a longitudinal health record. To overcome these challenges and successfully implement a longitudinal health record, healthcare organizations can follow best practices to ensure data accuracy, security, and interoperability. Let's explore some of these best practices. 1. Promote interoperability. Ensure that your EHR system is interoperable with other systems, allowing for seamless exchange of health information across healthcare providers and settings. Following industry standards such as HL7 and FHIR can help achieve this. 2. Implement strong data governance. Establish data governance policies that define how health data is collected, stored, and managed across its lifecycle. This includes ensuring data accuracy, completeness, and consistency while adhering to privacy and security regulations. 3. Engage patients in the process. Encourage patients to be active participants in their own care by giving them access to their longitudinal health record. Providing user-friendly patient portals or apps can improve patient engagement and allow them to track their health over time. 4. Ensure data privacy and security. Implement strong security measures to protect the integrity and confidentiality of patient data. This includes encryption, multi-factor authentication, and regular security audits to prevent unauthorized access or data breaches. 5. Regularly update and audit data. To ensure the LHR remains useful and accurate, healthcare providers should regularly update and audit the data within the record. This includes verifying that diagnoses, medications, and test results are up to date and that any errors are corrected promptly. 6. Train healthcare staff on LHR use. Provide training to healthcare providers and staff on how to use the longitudinal health record effectively. This includes understanding how to access and interpret data from various sources, and ensuring that new data is accurately recorded in the system.
Conclusion. In conclusion, the longitudinal health record is an essential tool for improving patient care, enhancing decision-making, and supporting better health outcomes. While implementing an LHR can be challenging, following best practices for data management, security, and interoperability can help healthcare organizations achieve its full potential.